Hello, my name is James Wilhite. Today we're going to go over IV, starting an IV and doing IV fluid resuscitation. There's a few things we're going to have to go over first before we get into actually doing the IV. First off, there's going to be certain times that we need to do an IV. Okay, so whenever any kind of medication administration or any kind of fluid resuscitation for, say, hyperthermia, heat exhaustion, heat stroke, we're going to need to get an IV started. Or also for someone vomiting, any kind of medications that we need to administer that can't go through the intramuscular route, we need to get an IV started. Okay, so what you're going to need to do is get your IV start kit, and in there's going to be a rubber tourniquet, like a rubber band. What we need to do is find that, and it's going to go around where we are going to get the IV started. So we need to find a patent line. So either like on your arms, your hands, EJ if you have to, a peripheral IV site. Okay? So then you're going to get your IV start kit, and it comes with an alcohol prep pad. So once you've got your tourniquet on, and I'm going to go right here from the left AC. I've got my tourniquet on. I'm going to take my alcohol prep, and what you're going to do is you're going to do your cleaning of the site in an aseptic technique. So what you want to do is you want to start on the inside and do small circles, and you're going to work your way towards the outside. That way you've cleaned from the inside out, and you don't have a possibility of getting something contaminated after that. Okay, so now you're going to pick which IV catheter you want to use. Depending on the size of the vein, whether you have big veins that stick out or whether you have small spider veins, will be the direction of which the IV catheter size you'll use. Like me, I've got fairly good veins, so I'm going to use a 20 gauge, okay? What you're going to do, take your 20 gauge IV catheter, make sure it's in date, and which it is, expires in 2023. Take it out and take the safety cap off. Okay? We've got it out. Take the safety cap off. Okay, and so whenever you're using the IV catheter, you want to make sure that the plastic sheeting around the needle is free floating and it's still on the needle itself. Okay, and then you need to inspect your needle to make sure there's no damage to it. And then also you're going to want to use the needle with the bevel end up and the flat portion of the needle down. Okay, so we've got our site cleaned aseptically. So now we're going to insert the IV, but you're not going to go straight in at a 90. You're almost going to go in at a 45-degree angle. Okay, you're going to go in about an eighth inch to a quarter inch until you see a flash in your flash chamber, and then you're going to insert it just a little bit more, and then you're going to push the catheter up off the needle and thread it in. And then once you've got it most of the way in, you're going to pull the needle out and retract the needle back into its safety spot. And once you've got your needle all the way in and secured, then you're going to, I've got it occluded off, okay? So you're going to take your IV, your hep lock, and you're going to connect it to the IV that's in your arm, okay? And when you do this, you're going to want to make sure that you've got a good pull. You're going to pull back on it, which you should see blood come back into the syringe. And then you're going to flush it to where the syringe, you lose all the fluid in your syringe, and the plunger is free move. It's able to move really easily. Okay, so once you've got all your flush all the way in, okay, you're going to take it off of the hep lock, and I'm going to have my everything secured to my arm, okay? So once that's done, we need to do a fluid resuscitation to a patient, okay? You're going to make sure, bring your IV bag, make sure that it's sealed properly in the package that it's supposed to. Then you're going to check the date. You want to make sure that the date is within normal range. So like today is June the 6th of 2021. This one expires in May of 2022. So we are in date. Okay, you're going to take it out of the package. Okay. Then you're going to take your drip set, which this is a 20 drop set. Okay, and I'm going to attach it I'm going to take the blue plunger off of this IV bag, and I'm going to attach my drip set to the tube with the blue plunger, and I'm going to thread it all the way through the tube to the very end of the chamber over here on the drip set. Okay, and then I'm going to fill my chamber about halfway through with saline. And that way it just helps get the saline to start moving a little bit quicker. Okay, then I want to make sure that I get all the air out of my drop set tubing. Because if we keep any air in there, we're going to cause an air embolism, and we don't want that at all. So once we've gotten to where the normal saline is flowing freely out of the connection, then what we're going to do is we're going to shut it off. And then you come over here to your IV site, which you started, and you're going to attach your drip set to the HEP lock. Then you're going to secure it down. And then you're going to come back to your drip set, and you're going to set it to the rate that you want. Whether it be TKO, just so that you could keep the vein open in case you need to give medicines, or maybe you need to do it wide open because you have a patient that is hypotensive and needs a fluid bolus. So whether it be TKO or wide open, you need to check and pick which drip rate that you would like. And once you got your drip rate set to the way that you want it, you're going to attach your IV bag to somewhere that's higher than where your patient is at, and you're going to be, that way it's gravity fed. And then once that is finished, that will be your IV set and your fluid resuscitation. Thank you.